Good morning, students. Today I will discuss one important muscle of the upper limb, which is important from practical point of view, clinical point of view, as well as there may be a short note on the theory examination. And that muscle is the deltoid. You all know this muscle is the deltoid. The name deltoid means it is delta shaped or triangular. And base is upwards and apex downwards. I will show you the attachments or rather the origin of the deltoid muscle, which takes origin from the clavicle and also from the scapula. If I show you the bone, it will be easy to understand what are the sites of origin of the deltoid muscle. Let's see the origins of the deltoid. You can see this is clavicle, this is scapula, and here is the joint between the clavicle and the acromion process of scapula. So it is called acromioclavicular joint. This is head of the humerus forming the shoulder joint. Now I am showing you the sites of attachment of the deltoid muscle. This is the lateral 1/3 of the clavicle, anterior border, and also the superior surface. So this is the clavicular head of deltoid. Then come to the acromial site. This is the acromial process. If I rotate this, you can see the acromial process. Here is the attachment of the acromial head of the deltoid. Then if I go more posteriorly, and you can see more posteriorly here, this is the spine or crest of the spine. Its lower border also, here is the lower border. It gives attachment to the scapular attachment of the deltoid. So deltoid having three parts at the site of origin: clavicular head, then acromial and spinous. These three sites of origin, and then all the three parts they are coming downwards like this and inserted here, where I am showing you this side. This is on the level of around mid-shaft level of the humerus. On the lateral side, there is a V-shaped rough area called deltoid tuberosity. Here is the insertion or distal attachment of deltoid muscle. So the muscle is coming like this over the shoulder joint. So it forms a rounded contour on the lateral side of the shoulder. Here you see this is called anterior part or clavicular part. This is called middle part or the acromial part. But the acromial part, it is having multipinnate its origin. That means there are four slips, fibrous septa coming downwards from the acromial attachment of the deltoid. And from the deltoid tuberosity, three septa going upwards to interdigitate with the four slips from the acromial process in this way. Can you see? So these four septa from the acromial process, three from the deltoid tuberosity. So this is the interdigitation of the acromial attachment of deltoid muscle. But the anterior part or clavicular part and the posterior part or spinous part, they are having no digitation. So only the origin of the acromial process, that part is the multipinnate muscle, but the anterior or clavicular part and spinous part or posterior part, they are not multipinnate. And regarding the action, I am showing you in the body. So let's see the muscle in the dissected part. Here you can see this is clavicle, this one. So from the lateral 1/3, it is the clavicular head, and middle part is the acromial, and the posterior part is the spinous part. So all the three parts converge together and they inserted in the deltoid tuberosity of the humerus. I already shown you here. This is the deltoid tuberosity. Here it is inserted. Let us see what are the function and nerve supply of this muscle. The nerve supply of this muscle is the axillary nerve. Both the anterior division and posterior division of axillary nerve supplies the whole deltoid. And its anterior fiber, along with the pectoralis major muscle, it acts as the medial rotator and flexion and adduction of the shoulder joint. And the posterior fibers or the spinous fiber, it acts as the extensor as well as adduction and lateral rotation of the shoulder joint. But the middle part or the acromial part, which is most important because it is very strong muscle, strong part of the whole deltoid, because it is having interdigitation and is a multipinnate component of the deltoid, it acts as one of the important abductor of the shoulder joint. Along with the supraspinatus muscle, the deltoid, it acts as a abductor. Besides this, one interesting question may be asked. Can you tell me which one is the fourth part of the deltoid? We know the first part, second part, and third part. Do you know? And that fourth part is the posterior inferior part, or called the fourth part, that is the teres minor, because it is supplied by the posterior branch of the axillary nerve, and whole of the deltoid, both all the three parts, it is supplied by the anterior and posterior division of the axillary nerve. That means the deltoid and the teres minor both are having same innervation. Because of this part, teres minor muscle may be considered as a posterior inferior part of the deltoid or the fourth part of the deltoid. And even again, if I come back to the deltoid once again, why this muscle is so important? Because here is the axillary nerve. On the surgical neck of the humerus, there is the axillary nerve. If this site is fractured, the nerve will be injured. So if the nerve is injured, this nerve supplies the deltoid, and deltoid is the abductor of the shoulder joint. So abduction will be hampered. But supraspinatus will be there. So complete abduction will not be lost, but partial abduction will be lost due to the paralysis of the deltoid, because it is supplied by the axillary nerve. And second importance is that if some intramuscular injection when given, this muscle is chosen for the intramuscular injection, and usually it is given in the upper part and lateral part of the muscle. So this muscle may be an important short note. So you try to draw a diagram of its origin and also the multipinate appearance of the acromial part and the deltoid tuberosity where it is inserted into the lateral side of the mid side of the humerus. So that's all for the muscle of deltoid.